I just want to talk about our supportive care needs survey that was conducted last year by Cancer Council New South Wales. This is not research that I was involved in, so I just want to acknowledge the authors from our evaluation team across KISS and the Daffodil Centre as well on these findings. And I'll just give you a quick overview of what the research aims and findings were. So the survey really aimed to understand the supportive care needs of people affected by cancer, but more importantly, to identify where those needs were unmet. As this really gave insight as to where there might be a gap in services, so where cancer patients said that they had a need for something but just weren't getting that service, or that need just wasn't being met. And it had a second aim as well, which was looking at awareness of Cancer Council New South Wales services and their experience with services. So I'm going to concentrate a little bit more on these unmet needs today, but also touch on the second aim, which was awareness of services. So the study used a number of different recruitment methods. So participants were recruited to complete an online survey through our CANAC community, also through Cancer Council New South Wales social media channels and newsletters. We also contacted stakeholder and partners such as Cancer Institute New South Wales and the New South Wales Government, Health Consumers New South Wales, and Cancer Voices New South Wales as well. So a number of different recruitment methods. And cancer, people living with cancer were asked questions around their supportive care needs. So they include questions around physical needs, so things like pain, exercise, helping with housework, psychological, so mental health, anxiety and depression, isolation, uncertainty about the future, financial, so whether they had needs or unmet needs around out-of-pocket costs associated with cancer and cancer treatment, whether they were feeling in control of their finances or not, service access as well, so obviously our Cancer Council services, access to transport, accommodation and counselling, but also health system and information, so whether they received information that was culturally and linguistically appropriate, and how they felt about their coordination of care as well, so whether their doctors were kind of all working together. And so the survey was able to recruit a total of 527 participants. And participants were divided into different groups depending on whether they had a current cancer diagnosis, past cancer diagnosis, or whether they were a carer. And so depending on what group they fell into, they were asked slightly different questions. But the total number of participants is just at the bottom there. So the majority of people who actually completed the survey had a past cancer diagnosis. So 268 participants there. Current cancer diagnosis 179, and carers, which was a total of 80 people. I'm not going to go and present all the findings of the survey, but I thought I'd just touch on the top 5 most prevalent unmet needs. And so these are presented here for people with a current or past cancer diagnosis, people with a current cancer diagnosis only, so that's in yellow, and then a past cancer diagnosis in blue. So as you can see, for people with a current or past cancer diagnosis, uncertainty about the future came up top, even higher, obviously, and not really a surprise for people with a current cancer diagnosis. So 70% of people said that was an unmet need. Also tiredness, getting help with doing usual things as well, fear about cancer spreading, and feeling down. So they were the top 5 in all those 3 groups. There were some other unmet needs that were also reported. So access to professional counselling was reported as an unmet need for all 3 groups. Information about emotional support and services available to you. worry that results of treatments are beyond your control, getting help with sort of feelings of isolation, learning to feel in control of your situation or your financial situation, and information about things that they can do to help yourself get or stay well. So things like, you know, healthy living and that sort of thing, and staying well from treatment. So some really significant unmet needs there, kind of across the board for different people across the cancer journey. And I should just mention, it's quite difficult to actually compare. You might be thinking, you know, were some of these needs higher in people with a current or past cancer diagnosis? Due to the sample size of the survey, we weren't actually able to accurately compare different groups, except for one finding, which I will talk about in a second. So we kind of just know the differences between the group, but we can't actually make that comparison, unfortunately. We would have needed a bigger sample size in overall and in both groups. I do want to touch on some other unmet needs that reported. So in terms of access to services, the most common unmet needs service was for exercise classes. So 37% of cancer patients and people with a past cancer diagnosis reported that as an unmet need. The most prevalent unmet financial need was for information about financial support and services available to you. So 34% said their need in that area just wasn't being met. So the one area we can make a comparison is with people with a current cancer diagnosis in regards to supportive care needs. So not surprisingly, supportive care needs were more prevalent among people with a current cancer diagnosis compared to people with a past cancer diagnosis. And also people in remission had higher supportive care needs than those in remission for longer. I just wanted to touch on the unmet needs of carers as well, because I guess carers are often forgotten. And they did report some really significant unmet needs as well. So these are the top 7 unmet needs that carers reported. So these included looking after their own health, including eating and sleeping properly, the impact that caring for someone with cancer has on their own life, including their working life and other activities. The unmet needs around getting emotional support for themselves as well. Obviously, it's also difficult for carers to go through that and really takes a toll emotionally. Information about support services for carers and partners of people with cancer was reported as an unmet need. Also information like people with cancer and with a past diagnosis of cancer, information about emotional and psychological support that was available to them, and ensuring that there is an ongoing case manager to coordinate services for the person with cancer, and also balancing the needs of the person they're caring for as well as their own needs was also reported as an unmet need, or getting help with that was reported as an unmet need. We did see some higher needs in regional areas compared to urban areas. So this was only, they only looked at this for people with a cancer diagnosis. So they didn't look at this for people with a past cancer diagnosis. And those needs were reported for accommodation near a hospital or clinic, and also money to help with paying for travel, treatment and equipment expenses as well. I just want to talk briefly about that second aim, which was patient sort of awareness of cancer council services. So only 51% of participants surveyed were told about cancer council understanding cancer booklets, and only 30% were told about 13, 11, 20. So that's actually really low number there who were just unaware of 13, 11, 20.